Public Health Team of the Year, Grand Forks Public Health Department. The Grand Forks Public Health Department has done extraordinary work to protect the health and safety of residents during the pandemic. Their communication activities have been key to keeping the public informed of mitigation strategies to reduce the spread of disease.
More than just this past year, they have shown a true commitment to best practices when it comes to public health. And so certainly the pandemic has caused us to all shift in many different ways, and the Public Health Department is not immune to that. The way in which the team has come together to take a look at the guidance and to implement new strategies, and then also to be willing to adapt to those strategies as we went through and learned more through the pandemic, is something that they did so well, and they did with a commitment to best practices.
During the spring of 2020, mass COVID-19 testing was initiated in response to a large workplace outbreak that required testing a large number of employees, family members, and close contacts. While healthcare professionals were testing individuals with exposures and symptoms, there was a need for surveillance testing in the community. Together with the University of North Dakota, the North Dakota Department of Health, and the North Dakota National Guard, Grand Forks Public Health started a campus and community surveillance testing program on campus. This program has performed more than 20,000 PCR tests and more recently expanded to the BinaxNOW Now rapid antigen testing.
Grand Forks Public Health as a team has a very productive attitude that allows them to meet these challenges, allows them to pick each other up. When you approach things with the right attitude and the type of professionalism that they do, success is one of those things that will come after that. It's going to follow when you approach a problem with the professional, positive, can-do attitude that they do.
Grand Forks Public Health started its own contact tracing program to investigate cases within the county. The personnel conducted a total of 3,941 case investigations and 2,142 interviews with close contacts of cases working 7 days a week.
We've done so many things to impact the community, and we're fine. In the beginning of it, it was kind of explaining rules and regulations to go by. And as you probably could guess, a lot of the public did not have a good response to that, especially like business owners, for example, who were impacted so much at the onset. But as we started to realize what serious situation COVID-19 is in our area, they started to show so much appreciation. I'll give you an example. So now we have a regularity of vaccination clinics that are going on every Wednesday and Saturday. We have mass vaccination clinics that are going on. And that's the time when we do get recognition. We do hear a lot of praise. We do hear a lot of thank you for everything that you do in the community. And that makes those long 50, 60-hour weeks, kind of erase those.
Through the leadership of the Data and Analytics team and Dr. Jill Walls, the Grand Forks County Health Officer, a daily Grand Forks Health Office dashboard was developed and distributed to policymakers and community stakeholders for decision-making support. Dr. Walsh issued health officer orders twice during the pandemic that included mask requirements in public places and mitigation efforts to increase social distancing. Maximizing the use of all available resources and tapping into the expertise of partners have been daily endeavors during the changing conditions. This is evident with the current collaboration with All True Health System to hold community-scheduled vaccination clinics with shared vaccination allocations.
I would say that we impacted the community by showing that we would be there for them. We would do what we can, and we would be open about it. So we didn't always have a quick answer to everything when it came to COVID-19, but we worked at it.
Prior to COVID-19, Grand Forks Public Health was on a quest to become an accredited health department by the Public Health Accreditation Board. Currently, the submission is pending. The dedication to public health overflows through this department.
I'd like to thank the members of the North Dakota Public Health Association for bestowing this Public Health Team Award to Grand Forks Public Health Department. The past year has really been a monumental experience for us as a team to respond to COVID-19, and I could not be prouder of Grand Forks Public Health and all the work that they've done. They've gone the extra mile every step of the way throughout 2020 and now into 2021. There have been some dark days that's required some really extraordinary effort to mount an effective response, but all the members just kept showing up every single day and giving their best and ensuring that the public remains safe from COVID-19.